Good mental health is absolutely fundamental to overall health and well-being. Technology pervades our daily lives, but technology and mental well-being might seem like profoundly antagonistic terms. However, there are excellent digital tools to help you reach mindfulness and practice meditation through technology. The COVID-19 pandemic has furthermore intensified the growing mental health crisis, creating an urgent and new mental health care needs. Fortunately, the tech world is capable enough and harness these needs with its innovations. Prescription-based video games, mental health care apps, and virtual reality systems along with digital pills and digital symptom tracking systems have shown their enormous and potential in addressing the growing mental health care problems. Prescription-based video games like Endeavor X are specifically designed for patients with ADHD. Most of these patients count children aged 8 to 12 years. These games include challenges and practices to focus on multiple tasks simultaneously with the game environment. These games are exciting examples of the tech tools to harness the modern-day mental health problems.
So this application, that is Endeavor RX, that is dealing with the individual who are suffering from ADHD. So there are games in which the individual use all his motor, sensory skills, the cognitive abilities and so on. So it is in vogue these days.
Mobile applications of mental health care have seen a huge hike post the COVID-19 crisis. These apps are specifically designed to cure issues like stress and anxiety and depression.
First of all, हमने देखा है after or post COVID-19, there has been immense applications, apps that are available to cure the mental health. For example, there is an application for improving the thinking skills. Like there is a therapy that we use like CBT, that is the cognitive behavior therapy, in which we tell the patients that they should improve their cognitive thoughts, like the irrational thoughts, it should be converted into the rational one. So this application specifically deals with the converting the irrational thoughts of the individual into the rational one. Secondly, one of the most important app is the passive symptom tracking app. Now what is this app doing is हमारे sensors attach होते हैं हमारी जो smart watches के साथ, and if an individual he is sweating more or he is feeling low and उसकी जो voice tone है, उसकी जो speed of voice है, उसकी जो bodily movements में अगर किसी भी तरह के changes आ रहे हैं, so this app's gonna track everything and it's gonna give a record of the weekly, monthly supervision of the entire bodily mechanism that is impacting the psychological well-being.
Virtual reality systems are another big boon in the world of mental health care. These innovative therapies have proven their ability in successfully treating anxiety, phobias, and post-traumatic stress disorder.
I want to mention about the anxiety disorders. Like according to DSM-5, there are anxiety disorders like phobias, specific phobia, social phobia, panic disorders with or without agoraphobia, generalized anxiety disorder, and OCD and post-traumatic stress disorder. They are considered in the separate category. So specifically, if I talk about the post-traumatic stress disorder, it is experienced in the individual who have some kind of traumatic experience in their life. उनकी life में कुछ ज़्यादा बहुत ही ज़्यादा इमोशनल अपहीवल हो गया है, लाइक आफ्टर द वॉर्स और द ट्रैजिक इंसिडेंट एंड इवन आफ्टर द डेथ ऑफ एन इंडिविजुअल. सो यहाँ पे हमारी जो साइकोलॉजी की फील्ड है, अब वो इस इंस्टेंस में क्या कर रही है, दे आर यूजिंग द एप्लीकेशन ऑफ द वर्चुअल रियलिटी, जहाँ पे वो क्या कर रहे हैं, एक इंडिविजुअल को इन वीवो एक्सपोजर नहीं दे रहे हैं. इन वीवो मीन्स उनको रियलिटी का एक्सपोजर नहीं दे रहे हैं, उनको एक तरह का एक वर्चुअल एक्सपोजर दे रहे हैं. हियर आई वांट टू एक्सप्लेन मोर. लाइक देयर वाज अ मूवी नेम्ड Game Over by Taapsee Pannu, and there she talked, she was suffering from PTSD. She was a victim of sexual abuse and उसको darkness से बहुत ज़्यादा डर लगता था. So जब उसके therapy sessions हो रहे थे, so जो psychologist था उसको with the help of that 3D व्यू में, वर्चुअल वर्ल्ड में उनको लेके जाता था थ्रू फेजेस. लाइक एक फर्स्ट लिट रूम लेके जाता था एंड ही यूज्ड टू से दैट आर यू अवेयर ऑफ दिस थिंग, आर यू कंफर्टेबल इन दैट पर्टिकुलर रूम. शी यूज्ड टू से येस. देन अगेन वो उसको थोड़े से डार्क लिटेड रूम में लेके जाता था. शी यूज्ड टू ही यूज्ड टू आस्क हर कि अब आप अवेयर हो, अब आपको कंफर्टेबल हो. शी यूज्ड टू से येस. एंड द मोमेंट ही यूज्ड टू टेक हिम टू दैट डार्क रूम, वहाँ पे उसको अनकंफर्टेबल महसूस होता था एंड शी यूज्ड टू से नो नो, आई जस्ट want to end this thing. So with the help of this virtual reality हम क्या कर रहे हैं, हम एक जो पेशेंट्स को उस सिचुएशन में नहीं लेके जा रहे, बट विद द हेल्प ऑफ द वर्चुअल रियलिटी हम उसको एक एक्सपीरियंस करवा रहे हैं. सो इन दिस वे जो उसके जितने भी ट्रॉमेटिक इवेंट्स हैं या फिर उसको जो इमोशनल अपहीवल हो रहा है, उससे इंकाउंटर करके उसको जितनी भी प्रॉब्लम्स आ रही हैं उसको बेनिफिटेड हो रहा है इन काउंसलिंग सेशन से, तो सो दैट द पर्सन कैन गेट एक्वांटेड विद दैट पर्टिकुलर phobia or anxiety disorder if he or she is suffering from.
Every coin has two faces, the head and the tail, or every topic has two aspects, the positive one and the negative one. And so is with technology and its complicated relationship with mental health. The fact that technology has harmful effects on mental health cannot be denied. But the fact that technology is playing the role of a catalyst in curing the growing mental health crisis should be appreciated adequately.